menopause. Okay, so many of the ladies who registered for this workshop, they have they are more towards the 50 age group, which is more towards the menopause. But still, I will go through the whole PCOD also. So polycystic ovarian syndrome or polycystic ovarian disease. So this is a endocrine disorder. What does that mean? Endocrine is related to hormones. Okay. So when there is an imbalance in the hormones of our body, that then these kind of diseases are coming into being. Okay. So what happens here actually is that the follicles. So what are the follicles? Follicles means those covering that are covering the eggs. Okay, we have eggs in the ovaries. There are many eggs at a time in our ovaries, and these eggs are covered with a small covering. Okay, very light covering, which is called follicle. Okay, so these follicles and the eggs inside them, they do not grow properly, and then what happens once they do not mature, the egg doesn't mature properly, then it becomes into a cyst. Okay, so it changes into a cyst instead of maturing and breaking the follicle and coming out and coming inside the ovary. So what happens is, see, this is what is the actual structure of our uterus. Okay, so this is a normal, see, this is a normal ovary. Okay. Sorry. This is a normal ovary. See, this normal ovary, it has this inside, it will have the eggs, and eggs will have a follicle as a covering. This is the fallopian tube. Okay. This actually, the egg is breaking from this ovary over here through, it breaks the follicle, it comes into the ovaries, and it travels slowly, and the sperm actually comes from here and it travels through this tube also, and it goes and meets the egg over here. Actually, this is the process of fertilization. But what happens in PCOS is, these here the eggs do not mature and the follicles do not break, and there becomes a cyst in the ovary itself. And even if the sperm comes inside, it will not get fertilized because this egg has not matured properly only. So this kind of cysts are created in the ovary, and there is no fertilization of eggs even if the sperm comes inside the body. Okay, this is how the PCOD or PCOS is formed. Okay, so now what happens actually? There is a hormonal imbalance. How this hormonal imbalance forms? Because of excess of this luteinizing hormone, which is released by the pituitary gland in the brain. Okay, the brain has our pituitary main gland. This hormone is released by the pituitary gland for fertilization. And this luteinizing hormone is released in excess in PCOD. Okay, when we have PCOD, this hormone is released in excess. Actual requirements से ज्यादा ये रिलीज होता है, और इंसुलिन भी ज्यादा रिलीज होता है. इसकी वजह से क्या होता है? Follicles in the ovary do not grow properly, क्योंकि इंसुलिन और ल्यूटिनाइजिंग हॉर्मोन्स ज्यादा हो गया है, तो एक मेल हार्मोन टेस्टोस्टेरोन तैयार होता है बॉडी में. ये बॉडी में तैयार होता है तो इट स्टॉप्स द मैच्योरिंग ऑफ एग्स. ओके, so this happens, and then what happens? Then only the egg doesn't mature, it forms into a small cyst. है ना. एंड देन देर आर अदर सिम्टम्स. जब टेस्टोस्टेरोन बढ़ जाता है बॉडी में तो फिर हेयर ग्रोथ होता है, एक्ने होता है. ओके, so the women get pimples or there is hair growth on the face. That is because of the testosterone. Testosterone is formed because excess luteinizing hormone and insulin is released in the body. Okay, so again what happens? Hormonal imbalance happens. Okay, so then when hormonal imbalance happens, there is also the fear of insulin resistance forming. There is a fear of type 2 diabetes mellitus forming, or in case of pregnant women, gestational diabetes happens, and again there is a problem. Even if the woman gets pregnant, this is the problem. Then there is a problem of high BP, high cholesterol, cardiovascular diseases, and I have not written over here, but also cancer. Cancer also can be one of the symptoms of PCOD, hormonal imbalance. Okay, so let's see what are the causes of menstrual issues. All menstrual issues, most of them causes are, major cause is hormonal imbalance that we saw just now. Then after that, why hormonal imbalance is caused? Because of high stress levels. Okay, even we go back even further, hormonal imbalance is okay, but why is this hormonal imbalance happening? Because of high stress levels, one thing, or due to some other internal dysfunction. डिस्फंक्शन इसका मतलब क्या है कि हमारा शरीर, आवर बॉडी इज अ मशीन, हमारा शरीर एक मशीन है, तो कभी कभी मशीन खराब हो जाता है ना. सो दैट इज डिस्फंक्शन. सो देयर इज नो रीजन, sometimes it happens that it doesn't work. Okay, so hormonal imbalance can be caused. I mean, it is not that only because of stress that hormonal imbalance is caused. It is also internal dysfunction can happen and hormonal imbalance can happen. Another reason for menstrual issues, अभी ये हम menstrual issues पे आते हैं. We are leaving back hormonal imbalance. We are going forward to menstrual issues. Why this happens? Many times due to bad posture, not sitting properly. Why? What happens if you don't sit properly? Sitting long hours on the laptop and computer, but you don't sit in the fashion that your body requires. So what happens? This lumbar region, back part, this part, okay, this part and the lower part of the body becomes stiff. Okay, there is no blood circulation in the body. So then what happens? There are blockages created, and therefore there is less oxygen supply in those parts of the body. Okay, तो क्या होता है, हम ठीक से बैठते नहीं हैं, और वी डोंट मूव फ्रीक्वेंटली. 2-3 घंटे हम एक ही प्लेस में बैठे रहते हैं, तो क्या होता है, ब्लड सर्कुलेशन रुक जाता है, वहां पे ब्लॉकेज क्रिएट होता है. ब्लड सर्कुलेशन नहीं होगा तो ऑक्सीजन कैसे मिलेगा वो पार्ट को? ऑक्सीजन ठीक से नहीं मिला तो फिर क्या होता है, वहां का जो फंक्शन होता है वो ठीक से होना बंद हो जाता है. ओके, सो देन व्हाट हैपेंस? जब पीसीओडी के सिम्टम्स, मतलब अभी हमें पता कैसे चलता है कि अभी हमको पीसीओडी हो गया, तो हमें इरेगुलर पीरियड्स होने चालू हो जाते हैं, या पीरियड्स 2-3 महीने नहीं आते, दे डोंट कम ओनली, और वेरी हैवी ब्लीडिंग और स्कैंटी ब्लीडिंग, ये भी होता है, मतलब नॉर्मल नहीं होता है. ओके, देन देर इज पेन इन द स्टमक, पेल्विक रीजन, लोअर एब्डोमेन. देन स्किन क्या होता है, ऐसे एकदम, एक मिनट है, somebody has come. Skin also, skin type changes because the blood circulation also is not there, so skin type also changes. एक्सेसिव हेयर ग्रोथ, ये हमने देखा क्या होता है, हाउ excessive hair growth comes. Then there is acne on the face, back and neck. So pimples आना शुरू हो जाता है, या फिर वेट बहुत बढ़ जाता है, वेट इंक्रीजेस, और वेट लॉस भी हो सकता है क्योंकि हॉर्मोन्स के ऊपर डिपेंड है ना ये सब। फिर मेल पैटर्न, मेल पैटर्न क्योंकि क्या है, मेल हार्मोन सीक्रेट ज्यादा होने लग जाता है, तो मेल पैटर्न का बाल्डनेस है, हेयर अफेक्ट होता है। somebody is trying to enter. Okay, baldness because body processes more male hormones, baldness होने लग जाता है, inability to conceive। तो जब cysts होता है ओवरी में, egg is not matured so it doesn't get fertilized, so pregnancy नहीं होता है। और उसके बाद क्या होता है, hormonal imbalance से फिर एक धीरे 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 डिप्रेशन आना शुरू हो जाता है। ओके, we start having depression। तो इसमें क्या होता है, सपोजिंग हम कंसीव भी करते हैं तो क्या होता है, हायर रेट ऑफ मिसकैरेज बिकॉज द एग इज नॉट प्रॉपरली फर्टिलाइज्ड, सो दिस देयर इज अ very danger of miscarriage. Also, we can get high BP, which is pregnancy induced, or diabetes, or type 2 diabetes, or premature deliveries, or the child has higher risk of dying after getting born also because it is not properly formed. This is because the egg is under matured and there is hormonal imbalance between the ratio of the two hormones। तो क्या होता है, फादर से 26, मदर से 26, ऐसे करके क्रोमोसोम्स रिक्वायर्ड होता है, लेकिन यहाँ पे वो इम्बैलेंस होता है, इसलिए वो प्रेगनेंसी प्रॉपर नहीं होता है। ओके, देर आर कॉम्प्लिकेशंस। ओके, समवन नेम्ड लक्ष्मी हैज कम इनटू द रूम। Okay, those who have come late, I am explaining very shortly once again. Basically, I'm going back a little bit. So PCOD is basically the polycystic ovarian syndrome, or high BP or diabetes or premature delivery, or the child might be at risk, or because the egg is under matured, there is hormonal imbalance in the ratio of the two hormones. Okay, now what is the remedy for all this? One is weight loss in case of obesity. So in case of obesity, we always prescribe कि भाई थोड़ा वजन कम कर दो, उसके बाद आप you go for pregnancy. So there are many remedies in this. One of the main remedy is Laghu Shankha Prakshalan, where we clean the body completely by drinking lots of water and doing 4 asanas. Okay, so this is Laghu Shankha Prakshalan, which we prescribe for obesity. First thing is to clean your gut. Okay, clean the gut. Then lifestyle changes you have to do. The 3 main factors which affect your hormones are diet. If you don't do proper diet, not just the food that you eat, but the time at which you eat, and after eating, what is it that you are doing. Then next is sleep patterns. Sleep patterns have a very deep connection with your reproductive organs. Okay, that I will explain. There is another separate slide for that. And you have to do yoga preferably, or you can do exercise, whatever. I'm not saying that exercise is not good. It is good. Any kind of exercise to the body will always help you. But yoga is, I will explain in the coming slides how yoga is targeted exercise for your hormones. Okay. So the yoga is the only exercise regime that targets the hormones. Okay. And all yoga postures are primarily designed to reset your hormonal imbalance. This I will explain how it happens. Okay.